Throughout history, infectious diseases with pandemic potential have emerged and spread on a continuous basis. Many communicable diseases that cause pandemics are caused by zoonotic pathogens that spread to humans as a result of increased contact with animals due to breeding, hunting, and global trade. Following that, rising human population, expanded cities, expanded trade territories, increased travel, and ecosystem effects all contributed to the emergence and spread of infectious diseases, increasing the risk of outbreaks, epidemics, and even pandemics. The terms endemic, outbreak, epidemic, and pandemic refer to the occurrence of a disease in comparison to its expected rate as well as its geographic spread. As we all know, significant pandemics and epidemics like plague, cholera, influenza, severe acute respiratory syndrome coronavirus or SARS-CoV, and Middle East respiratory syndrome coronavirus or MERS-CoV have afflicted humanity, and people have learned how to deal with these situations to minimize the overall damage. But in today's video, we will focus on the infectious disease that caused great havoc in the present. Coronavirus disease, also known as COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. Most people who get COVID-19 will have mild to moderate symptoms and recover without treatment, but others will become extremely ill and require medical attention. When an infected person coughs, sneezes, or breathes, the virus can spread through tiny liquid particles from their mouth or nose. The size of these particles varies from larger respiratory droplets to the tiniest aerosols. Symptoms of this infectious condition include a dry cough, fatigue, and fever. Pneumonia, for example, is a condition that might affect some people. You can also get sick by touching things, not knowing it is contaminated or not, and talking to people you don't know are infected. The only way to survive this deadly disease is by following these safety protocols. Always wear your face mask to avoid inhaling the virus. Avoid going to crowded places and public gatherings to prevent possible transmissions. Keep at least 1 meter distance from people when coughing or sneezing. Clean all shared surfaces frequently and avoid touching your face after use. Avoid going on unnecessary trips to lessen the transmission. If you're sick or at risk, don't go out. Isolate yourself instead to maintain safety. It is also a good idea to stay at home while working there. And lastly, get vaccinated. When more of the population is vaccinated, possibilities of having infected are further decreased way to something referred to as herd immunity. By this, getting vaccinated not only reduces your chance of being infected, it also contributes to community protection, reducing the likelihood of virus transmission. You and I, together with everyone, we can survive this.